Good afternoon, everyone. Glad to be with you again this afternoon. I know it's hot out there. Hope everyone had a good weekend. We'll talk a little bit about the weekend after we talk about COVID to begin with. So I want to just say that, across the country, and you all know this, the U.S. is, we're seeing big rises in the number of positive COVID cases across the country. In some states more than in others. In Missouri, we are seeing some cases rising, primarily in southwest Missouri. In fact, I saw this morning in a newspaper, national newspaper, that had profiled Joplin, Missouri, so far southwest Missouri. Here in St. Louis, we're still very concerned about COVID because COVID is still very present with us. We are doing a lot more testing. We are finding more cases. We are also finding, I'll talk to you about the numbers in just a second, but we're also, the private labs that process most of these tests, Quest and LabCorp, because there's so many tests being done, those labs are seeing a backup. So we're concerned about that, frankly, because we don't know what the results of that will be. Every day that you wait, you're more concerned about those backups. But let me tell you about the current numbers and tell you why we still, although we're concerned, we are still feeling pretty good about where we are here in the St. Louis region. So for the numbers, there are currently 2,490 cases. When I say currently, it's yesterday. 2,490 cases in the city of St. Louis. Now, the positive numbers that we've been getting day to day are 7 yesterday, 15 the day before, 20, 28, 24. Last week, one day, early in the week, we had 47 and 53. So we are still seeing a downward trend, but as I said, we are concerned about the backlog of cases from these private labs. It'll go to the state and then it'll come to us. So we don't want to overly rely on these good in quote, number of case numbers. Now, one of the things, though, that we do know that we can rely on is the number of people that are in the hospital. And right now, there are, both for the confirmed cases of COVID and the suspected cases of COVID, there are 230 people in the hospital in the region. And that is pretty much in line with where we have been. That number, again, it's a couple of days old because those hospital numbers always are. But it was 230, 258, 247, 255. So you can see this number goes up and down a little bit each day. 52 people in the ICU. And again, over the last month, that's been as high as 62. Well, actually, in early June, it was up in this range of about 75. And so here we are today at 52. And 27 people on ventilators. So we are we cautiously optimistic, maybe is the word here. We saw patients admitted to the hospital each day, new patients admitted, 23 people, 24 people, and this is in the region. And so the concern here, as you is that COVID is still very much with us. People are out and about more and more. Not everyone is wearing a mask. Although I will say that I was at Ted Drew's over the weekend. I hope some of you got to go there too for a little ice cream. And I would say a good 85 to 90% of the people who were in line had on a mask. That encouraged me because we know that masks are now mandatory when you go out in public and you're inside. Now, these people were all in line and they were outside, but they were still wearing their masks. So that is encouraging. You know, the reason that we harp I harp, all of us do, on this mask wearing so much, is that it's the only way that we're going to be able to hopefully keep all of our businesses open. And for me, we need our businesses to be open because we need our people to go to work, to earn a paycheck, to be able to support themselves and support their families. And so this mask wearing is the only real thing that we have without having to pull back the reins on businesses. And we really don't want to do that. We're going to work very hard not to do that. So those are our COVID numbers. I would just say this, that I get it, wearing a mask can be kind of irritating, annoying. You know, you forget it, you leave it in the car, you got to run back and get it. Those are small inconveniences compared to taking steps that would have to restrict the businesses that are open. So I empathize with folks who are irritated by this, or people that just, you know, are annoyed by it, but please put up with that annoyance. We've got so many cases across the country. St. Louis is doing pretty well, but we need to keep doing that. So thank you for wearing a mask. It is mandatory when you go to a public place, an indoor public place, grocery store, hardware store, and it is strongly encouraged when you are outside, and it's mandatory if you think you will be in a situation where you might not be able to be socially distanced within 6 feet. So that's that. Our numbers look reasonably good, but we're worried about them. So I want to go from there, because I was talking about, you know, the tremendous effect on business, to talk for just a minute about Slate, which is St. Louis Agency on Training and Employment. And so Slate today is once again beginning to offer on-site services at Slate here at 1520 Market. You do need to call for an appointment, but Slate is where folks who are in need of jobs, and I know many people are in need of jobs right now, can get additional training, can get connected with job openings that might fit their skill set. For those of you that want to set up an appointment to go visit Slate, I'm going to give you the phone number here. It's 589-8000. So obviously 314-589-8000. And it is, they will set up an appointment for you if you want to go in for training. They will also help you over the telephone, and they can also help you online. But they have a lot of procedures in place to make sure that people can be socially distanced, and you got to wear a mask if you're going to go to Slate. So 589-8000 for Slate training or employment. Now, on to another really very serious public health crisis. Obviously, COVID pandemic, huge public health crisis. Violence in our city, huge public health crisis. Over the weekend, the 3-day weekend, there were 7 people that lost their lives to violence in the city of St. Louis. 17 other people that were injured through gun violence over the city of St. Louis. That's a total of 24 people. That's 24 lives that are forever changed. Those 24 people, but in addition to that, their families. So maybe 10 people, their families, their close friends, 10 people, 20 people. You multiply the effect of gun violence on not just the individual, but on their entire family and friend group. Their lives will never be the same either. You probably heard that the youngest person who was injured, and he's very seriously injured, is a 4-year-old little boy who was hit by stray bullet. And, it is senseless firing off of guns. Those bullets all come down, and they come down somewhere. And in this case, a little 4-year-old boy is fighting for his life as a result of that gunfire. And I know there was a lot of gunfire over the weekend because I heard it also. In addition to the fireworks, of course. I know fireworks are a whole nother subject. But the prevalence of gun violence in our city and in our region, frankly, it's not just in the city, but in our city and in our region, is just devastating our communities and our families. And it's not just happening here in St. Louis. That doesn't make it any better. It's happening across the country, in big cities across the country. We know that in Missouri we have very, very lax, lenient gun laws. And we know that way too many differences are settled with gunfire rather than with words. And of course, we have Cure Violence, which has begun operating a few weeks ago. We are going to begin implementing cops and clinicians. You know that we are 145 police officers short of where we should be. But it's both the prevention side and the enforcement side. And I just couldn't talk to you today just about COVID without talking about what is an equally huge public health crisis in our area. In the city of St. Louis so far this year, there have been 111 homicides. And here we are, it's only the 6th of July. And 111 homicides and 158 deaths from COVID. And in addition to that, while I don't have the current number, also a number probably approaching 100, maybe even exceeding it, of opioid deaths. And this is a culmination of COVID and guns and drugs. And our police department is doing everything it can to respond to those. But we need all of you to do everything that you can to intervene if you know someone who is in a argument, a spat, disagreement, serious disagreement. We need for you to help as well. So anyway, there's just 7 people killed, 17 people injured over this 3-day weekend. A very tragic weekend, and definitely gun violence is a public health crisis in our community and across our country, especially in big cities. So, thank you for taking a minute to visit with me about that. Jacob, do we have questions? I guess I have one other thing here, sorry, to bring up, and that is you can expect to hear maybe later this afternoon or tomorrow. Our health department has been working with the schools, both St. Louis Public Schools, charter schools, parochial schools, independent schools, all the schools in our city, and have issued, are in the process of issuing, along with the schools, guidance for the reopening of schools, which is coming up before we know it. Here we are on the 6th of July, so maybe another month or 6 weeks before schools open, 6 weeks probably. So the requirements will be that every school will have to have, this is just in a nutshell, an infectious disease plan, and have protocols in place for when someone is sick, when someone has COVID. And let me just say that one of the things that we know is that in every group of people, there are probably people who have COVID. And how do we know that? We just heard over the weekend the Cardinals have 2 or 3 individuals on the team who tested positive for COVID. The Blues have some folks. The city has some folks. Wherever you work, most likely there's some folks that you work with who either are or have been positive for COVID. So this is really important in schools also, because we're not expecting that schools will be free of COVID. So it's very important to have this infectious disease plan in place and the protocols for when that does happen. There will be extensive health screening requirements, temperatures, questions about how people are feeling, very strict, stay home if you're sick. There will be social distancing requirements, obviously cleaning and disinfection recommendations from the CDCs, face coverings, requirements while in the school building, and while on buses. Most of our kids, not all, but a lot of our kids in the city do take a bus to school, gotta wear a mask. You know, this is gonna be hard for our kids, although maybe they're getting somewhat used to it, but you know how kids are. They're playful, they're playing around, they're goofing around. I can just see right now somebody pulling somebody's mask off and that sort of thing, just not in a bad spirit, just goofing around. And so it's going to be hard for our kids, and for you parents, I know that you'll be talking with your kids about the importance of wearing a mask and keeping their mask on. Smaller groups, that sort of thing. So you'll be hearing more on that because, as I said, here we are on the 6th of July, not too long before school starts again. And most school, we believe at this point, will be in person. But it'll be different. It's not like going back to the way it was before March 18th, I think was the date that schools closed last spring. So anyway, those are four of the big topics for today. I'm glad to take some of your questions and appreciate all of you being with us.
We have quite a few questions, Mayor. So starting on violence and crime, we have a question from Kyle who asks, with the violence the city saw over the weekend, what is the status on Cure Violence implementation? Is there anything citizens can do to assist?
Well, Cure Violence is being implemented. We launched that in the Wells Goodfellow Hamilton Heights neighborhood it was around the 1st of June. Well, maybe 3 weeks ago. I'm going to say 3 weeks ago. And so it is underway, and we are in the process of selecting the entity which will launch Cure Violence in both the Walnut Park East neighborhood and in Dutchtown in the next few weeks. So there's a lot of training and hiring and training involved in that. So Cure Violence is one part of prevention and an important part of prevention, and it is launched on in one neighborhood right now.
Brandon also has a question about Cure Violence, Mayor. There have been public statements from other public officials that Cure Violence was significantly delayed. Can you address that? And I think you sort of just answered this next part, but the next phases and what the implementation of the other neighborhoods look like. Right.
So it was delayed by COVID. You know, we were in the process back in February and March of awarding the contract to the entity, and it's Employment Connections who has the first contract to implement Cure Violence. And then COVID hit and no one could interview and no one could go out and knock on doors and all those kinds of things, so it was delayed by that. But it is in place now, and hopefully within the next few weeks we will have the other 2 neighborhoods awarded to an entity. They have received proposals, and that will begin happening.
Channel 5 submitted a question, Mayor, asking if you could respond to a travel advisory that was issued by a state senator out of Jefferson County urging people from Jefferson County not to come to the St. Louis region because of violence that happened over the weekend.
Well, I saw that, and I would just say this, that one, lots of people from Jefferson County work in St. Louis. We're happy that they do. St. Louis and St. Louis County, both. And folks in St. Louis and St. Louis County go back and forth. So, you know, there is no reason for someone to be concerned about coming to St. Louis and coming to your job. And so I certainly think that was not the kind of comment that we'd like to hear, but I understand that sometimes people make comments when in the heat of the moment.
We do have a couple of COVID-19 related questions. So Tracy submitted a question asking, what phase is the city of St. Louis technically still in? Would you still call this phase 1?
So, what's the person's name?
Tracy.
Tracy, you know, we've addressed this before. This has been a continuum. And so all types of businesses are now able to be opened with restrictions. And so it's not like phase 1, 2, 3, 4, really, because now all businesses are reopened, but they're all reopened with restrictions. That means social distancing and mask face coverings. And so we hope not to have to pull back, because we've issued lots of orders along the way, and we hope not to have to pull back and pull some of those businesses back. I mean, I guess some people in some locations across the country, what you have seen is that mayors and governors around the country have gone back to carry out only for restaurants and bars. We really don't want to do that. Our restaurant workers and our restaurants have been so severely impacted, and that's why we are pushing face coverings and masks everywhere. And I know some people are going to say, well, you can't wear a mask when you're in a restaurant. No, you can't wear a mask while you're eating, but you can certainly wear a mask when you walk into the restaurant. You get seated at your table with your family, your close group. Then you can take your mask off. Your server will have a mask on. The bus person will have a mask on. All the workers will have masks on. If you need to get up and go to the restroom or something, then you've got to put your mask back on, other than when you're sitting at your table eating or drinking. So we are very hopeful that we do not have to pull back on that.
Another COVID question, Mayor, from Devin, who's watching, wants to know if there's any update in the city on extending eviction freezes. Rent was due a couple of days ago.
So that actually is not something that the city gets to decide. It is the circuit court, and the judges decide that. And you might know that the eviction moratorium is being lifted as of today now, and that's by a court order. We'd like for it to be extended longer, but we understand that now in a couple of days, we hope we're going to have passed by the Board of Aldermen the CARES Act funding, which will help us with mediation between landlords and tenants. So the folks that are potentially evicted this week are folks that were already being evicted before March the 15th. So there were folks before COVID hit. Now, beginning today, tomorrow, folks that are in an eviction status who haven't been paying their rent or working it out with their landlord are potentially beginning the eviction process. So that will take a while, and hopefully during that period of time we can help folks work it out. So
we have a follow-up question from Sarah, Mayor, on CARES Act money allocated for housing assistance and evictions. If the Board of Aldermen haven't passed it yet, is it going to be available for the people facing this first wave of backlogged evictions?
Well, the evictions that we're talking about that begin today, those are folks that, as I mentioned just a minute ago, were being evicted before March. So yes, by the time any new folks, the money will be available. I mean, I'm confident the Board of Aldermen is going to get this passed. There are just some steps that have to happen. And so I think that will all work out fine, because this is COVID-related evictions that we really are going to try to mediate and try to help people stay in their houses. You know, we talk a lot about homelessness, but the biggest part of homelessness is preventing people from becoming homeless. And so there's a lot of effort there. And of course, you all know that we have added about 220 beds, 222, I think, homeless beds, that were necessary because some of our homeless shelters that are operated by other not-for-profits had to reduce their population during COVID because they needed to get people further apart. So it's a complex situation here, but we are always trying to prevent folks from becoming homeless, which is what the rental assistance, mortgage assistance, mediation is all about.
We have quite a few questions related in general to the enforcement of the city and county mandatory mask order.
Mm-hmm.
Related to if they see a business that's not enforcing it, should they report them? And what do you do if you see people who aren't following it?
So I think there's a couple of answers here. One, you can call 622-4800 if you want to report a business that you think is not complying. Our goal with that business will be to contact them and help them to comply. The other thing that you can do personally is you can offer people masks. I've said this before, and some people think, well, maybe that's kind of silly, but I know for a fact that there are some folks who just show up there and they've forgotten their mask and they're happy to have another one. So you can report businesses. I would offer someone a mask, and I have done that a number of times, but I wouldn't get into a confrontation with them about it. But they if they're going inside a place of public accommodation, store, retail store, restaurant, etc., they need to have a mask.
Toby submitted a question, Mayor. They are watching, wants to know why the city is spending $8 million to detain people in the medium security institution. They feel like this is fiscally irresponsible since there's room in the city jail.
So, we've addressed this question a number of times. I'm going to try to do it succinctly again. Last year, the budget for MSI was $16 million, and this year it's $8 million. And we hope it'll be less and less as we go along here. There are about 100 people at MSI. Those people are there on felony charges. And you may think numbers to numbers that all those people can pick up and go to CJC. But in fact, women have to be separated from men. And rivals have to be separated from one another. If you're going to run a safe jail, you've got to have the room to do that. Now, it's certainly our goal to have as few people in jail as possible, but I will just say right now that those folks that are in MSI currently are there on serious charges. And I think it would be irresponsible for us today to just say, hey guys, go on home. I say guys because at MSI they are all men at this point in time. There are around 30 to 35 women who are being detained in combination of our two jails, and they are all right now being housed at CJC. So it's a complex arithmetic here. Jails if they're going to be an accredited jail, which of course ours are, those jails are supposed to have at least a 15% vacancy rate. In other words, 15% of the beds are supposed to be empty. And so it's a complex situation that we have been working on, frankly, for 3 years. That's the reason we're in a position now. And it's not just us working on it, but the Criminal Justice Coordinating Council, which you all know we formed within this last year, and that's all the elements of the criminal justice system. We have all been working on all of this for a long time, as have, I give credit to the Bail Project, judges, lawyers, everybody's working on this. None of us want anybody to be in jail who doesn't need to be there, but the folks that are in jail today need to be there.
Follow-up question from Tish, who is watching, Mayor.
Tish.
Wants to know, while you've been in office, have you ever had the opportunity to visit MSI and or CJC? And if so, can you speak to the facility's cleanliness, safety, standard of food served, and health care that they have?
Yeah, Tish, I have been to both MSI and CJC more than once. And I will say I've never eaten a meal there. So, but the city has spent about $6 million at MSI. When I came into office 3 years ago, a little bit more than 3 years ago. MSI had no air conditioning, none. The day I walked in here, which was April the 18th, it wasn't that hot, but by Memorial Day, it was hot. And MSI had never had air conditioning. So the first thing that we did was we brought in big temporary air conditioner units that sat outside of MSI and pumped cool air into MSI. Today, those are replaced with what you would call regular, normal air conditioning. So we've air conditioned MSI. We've spent a lot of money on bathrooms and facilities, making them better. We're in the process, it may be done by now, of putting new units in the new part of MSI, which we call the pods. And we closed the older part of MSI over, has it been, probably a year ago. Within the last year, we have closed the dorms, they were called, which is the old part of MSI. No one has been housed there in over a year. So we've done a lot of work at MSI. We've done a lot of physical improvements to MSI. We've also, though, done a lot of improvements in terms of making sure that no one is there that needs to be out on bail. The people that go to jail, they're not people that we pick to go to jail. They're people that the attorneys and the judges decide need to be confined. And it's up to the city to provide the space for those people. We don't get to choose who goes to jail. So that was kind of a long-winded answer. It's a complex question, and I appreciate you wanting to know more about it.
A couple of other random city-related topics, Mayor. Kyle is watching and wants to know what percentage of residents in the city have completed their census so far.
Good, somebody just gave me that answer. So in the city of St. Louis, 49.5%. You guys, that's not that good, okay? Sorry, but in the whole state of Missouri, 62%, St. Louis County, 72%, and here we are sitting right under 50%. That's not good for our city, because the federal dollars that we get, which help us with Slate, which help us with the health department, which help us with homeless services, which help us with affordable housing, all those are federal dollars, and they're millions and millions of federal dollars, and they're dependent on what our population is. So if we don't get counted, if you don't get counted, and you live here, then our community's missing out on those federal dollars. So please, fill out your census. You go to,
I think it's census.gov.
I think it is too, census.gov. You would have gotten a card in the mail. If you haven't filled out, I've filled mine out, so I haven't gotten the second round or the third round, but I know that you are getting second and third rounds now. It's so important to fill out the census. It'll take you a minute, 2 minutes at tops to fill out the census, a very short form, really important for the future of our city and for the federal funding that we receive here, because it's all based on how many people you have. So please fill out your census. This is not, this under 50%'s not a number to be proud of. So help us out here.
Another random sort of city question, but Michael's watching and wants to know why during COVID-19 there are rental scooters almost everywhere.
You know, the rental scooters just went back out within the last couple of weeks. And, you know, there's no prohibition on using the rental scooters. I'm looking out my window here and I see about 4 of them lined up on the corner right outside the window. And I have been seeing people ride them. Now, bear in mind, you probably should, you know, wipe this down with a paper towel and some, you know, or Clorox wipe or something like that before you start riding your rental scooter. And you should definitely use hand sanitizer and not touch your face because, you know, they sit out there all day. Multiple people ride them. So just take some precaution if you're going to use rental scooters.
Paul is watching, Mayor, and submitted a question asking, will city swimming pools and recreation centers be open by August or September so our kids don't have to play in the streets?
So rec centers are open, and there are still some slots that are available for rec programs. Pools are not going to open. We don't have lifeguards, and, you know, couldn't you just use a good pool today? I mean, what's the temperature out? 95 or
Yeah,
I don't know
it's in
the
the
temperature
90s.
right now, but and that's really unfortunate that pools are not going to open. But rec centers are open, parks are open. Our parks in the city of St. Louis have stayed open the entire time. So take a Frisbee or something and go out and run around in the park. I was in a park over the weekend, and it was very encouraging. Lots of people there having a little picnic or something. Everybody socially distanced, blankets far apart from each other. And even though it was hot, people were enjoying themselves. And so stay hydrated, get out and use our parks. We have 109 parks in the city of St. Louis. 6 of them we call major parks. They're the big ones. But the other 103 are neighborhood parks. And I think it makes a big difference. And so get out and use our parks.
Gloria's follow-up question to that, Mayor, is can you speak to the city's 75 playgrounds?
So playgrounds are, we still really aren't advising you to take the kids to the playground. And it really, you'll have to make your own decision on that. But it really just has to do with, there is no way for us to clean playgrounds. Now, maybe you can hand sanitize, wipe down things enough. It's hard. Kids want to go to the playground and they want to play on that equipment. But how many times have you not seen a kid, their face on the equipment and that sort of thing? So you'll have to, you can decide that, because I know there's a lot of playground equipment out there, and I know some people are using it. It is not something that we think is necessarily a best practice, but you can figure that out.
Dan is watching, Mayor, and has a question about the Buda Rec Center, which was temporarily transformed to help unhoused individuals during COVID-19. The original contract was for 60 days with 30-day extension. Wants to know if there's a plan for this to become a rec center again by the end of July.
So Dan, it's not really a contract. The city owns Buda. And there are, if I would have known this question was coming, I'd tell you how many people were there today. It has a capacity, I think, of 28, I believe is the number. And it is both a transition center and a center where some people stay for a while. And we are trying to transition people out of Buda and out of this emergency shelter and into other shelter or apartments. And we're working every day on that. And you probably, if you've been reading the paper or watching online, you know that we have more and more people that are homeless in our city. And I think that, we can expect that that's going to continue. Now, we do not expect Buda to be a homeless shelter long term. We do expect to get that figured out in the near future. So appreciate your patience with that.
We have a question about masks from Carrie, Mayor. Are there exceptions carved out in the city's mandatory order? I guess it could be he. Carrie has asthma and has doctor's advice not to wear a mask.
Yes. Respiratory conditions is an exception in the mask wearing. So if you have a respiratory condition and you've been advised not to wear a mask, that's okay. Of course, you got to take care of your health. But I would just add to that, which is that if you do have a respiratory condition already, you need to be extra careful if you're going to be out and about in public working without a mask, because you've already got a respiratory condition. So just be extra careful. Stay away from other folks.
We have a question submitted from Deidre, Mayor. She lives in Skinker de Bolivar. And
Hi,
she's been
Deidre.
concerned about crime incidents at the Forest Park Metrolink stop. Can you speak to what the city and region are doing together to make Metrolink safer?
So Deidre, the Forest Park Metrolink stop has had, I'm sure you've noticed if you ride it regularly, it has had some improvements over the last 3, 4, 6 months maybe. And that has to do with how folks get on and off the platform and that kind of thing. Metro has been working very hard. They have new security personnel that have been hired and trained. Again, this is over the last several months. And crime on Metro is improved. And I always hesitate to say that because one crime is one crime too many. So Metro works on that constantly. They work with our police department as well, and they have private security. So
We've got time for like 2 more questions, Mayor. So Jordan has written in and asks and says that we don't have, quote, mask police. So how will you enforce the mask wearing?
we don't have mask police. We don't give, despite what you might read on social media, we don't give tickets. We use the persuasion approach, and we ask businesses to do some enforcement as well. We have provided masks to thousands, many thousands of people in our community through our housing authority, to all the public housing complexes, through churches, through our homeless shelters, through our social service agencies. Probably missing something here. So yes, there are no mask police. You know, I said this maybe a week ago. Do you remember when the smoking ban came into play? It's not the same thing, but a little bit of an analogy here. So when the smoking ban came in, and all of a sudden you could not smoke inside in bars or restaurants or that kind of thing. And when the smoking ban came into place, it just became, people just didn't do it anymore. There was some peer pressure that was involved in that. And so I think the same is true with masks. And again, the thing that I would ask you is just to remember that wearing a mask can help us keep our businesses open and help us keep our employees employed. Of course, we don't want anyone to get sick, but we've got to figure out, we've got to adjust how to coexist with COVID. And a mask is our only, mask and social distancing is our only pathway right now. We just don't want to pull back on opening our businesses.
Almost 3 o'clock. One of our last questions, Mayor. Bob submitted a question asking you if you could speak to how fireworks went over July the 4th. There were clearly a lot all over the city. And if you know that if the city will be out to clean up some of the debris left behind.
Well, I would ask you to help us clean up that debris. We don't actually have a crew of people with brooms and all of that can go clean up all these parking lots. There were, as we worried there would be, there were more fireworks than ever. There were no firework displays. Fireworks were cheap, I'm told, this year. I didn't ever buy any, of course, myself, but I'm told they were cheap. I saw on one of the news channels it's just what it looked like around the city. This was apparently filmed maybe from a high-rise building, and just you could see fireworks going off around the horizon. People were hurt. One building burned to the ground as a result of fireworks, and it was a historic building in Old North, neighborhood just north of downtown here, that had was really just beginning to be restored. They had hired architects, they had architectural plans, they had building permits. It was just being worked on to restore this old historic building, and so many fireworks burned the building to the ground. So, you know, we always talk about that. There were a lot of fireworks, and so I don't know. We plead with people not to use fireworks in our city, and they are illegal, of course. But you know as well as I do, there's no way you can tell where that firework noise is coming from. Sound bounces off of buildings and bounces around. Now, maybe if you see someone shooting them off, you know. But yeah, the fireworks were crazy, and what we feared might happen did happen, which is that people were hurt. Fireworks were combined with gunshots into the air. A building burned down, and gosh, I don't want to end this on this note. This was just handed to me because we were talking about the crime. And so the 4-year-old that was hit by a stray bullet has passed away. And that is just So tragic. So, at any rate, I'm sorry to end this on that note, but that's where we are. Thank you all. Appreciate you being with me today, and I'll talk to you on Wednesday. Thanks.